live stream webpage doesn't seem to be loading.
I just started it, Bill.
No, I'm not even there. It won't even let me select it.
Tony is monitoring, as is Nathan, so it should start recording in about 10 seconds.
Good morning and welcome to San Juan County Council's Tuesday, July 14th regularly scheduled meeting. We're now at 9:01, calling the meeting to order. If everyone could rise for the flag salute, please. Oh, Ingrid.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. Good morning. We'll now do our Coast Salish acknowledgement. Let us acknowledge we reside on the ancestral lands and waters of the Coast Salish people who have called this place home since time immemorial. With that, moving forward through our agenda. I'm sorry, Mr. Watson, were you able to correct the issue with the live stream?
Not on my page anyways, not yet.
I have it up on my computer.
Okay, must just be me then.
Well, you might want to reboot it, or we can get Nathan in there if you need it.
Nope, I was just testing it.
Okay, thank you. Mr. Stevens, are you okay for us to move forward?
Yep.
And did you get the materials that you were looking for?
Let me check.
Stevens?
Nope.
Did you both get the minutes? Do you have the minutes, Mr. Stevens?
It's coming.
Well, here's the issue. I go to the K drive, and if it's a PDF, I can't open it. So the meeting minutes are a Word document, so yes, I do have them.
Okay, and Ingrid just mentioned that she just sent you more documents. Hopefully you can open them. I apologize for the issue. We'll try to get you Word attachments that work every week with a little bit more advance notice. My apologies, Mr. Stevens.
Well, I've advanced notice this is like the third time. So anyway, let's move on.
Thank you, Mr. Stevens. So have you both had an opportunity to look at the July 7th minutes?
Yes.
Entertain a motion for approval.
So moved.
Second?
We have a motion and a second for approval of the July 7th, 2020 meeting minutes. Any questions or comments? Without seeing any, all those in favor say aye.
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 Opposed? Motion carries 3-0. Thank you very much. Have you had a chance to look at the consent agenda?
Yes.
Mr. Chair, I move we approve the consent agenda for San Juan County Council meeting of Tuesday, July 14th, 2020.
Second.
We have a motion and a second for approval of the consent agenda for July 14th, 2020. Any comments or questions? Without seeing any, all those in favor say aye.
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 Opposed? Motion carries 3-0. Thank you very much. Is there any correspondence that either of you would like to bring forward that I don't see any here, but is there anything that we'd like to discuss or work on this week?
I don't have anything.
Nope.
All right, thank you very much. I do not either. I'm going to have need to add one addition to the agenda is we need to add an executive session to discuss real property acquisition pursuant to RCW 42.30.1101B. And Ingrid, if we can add that after the closed session that's set at the end of the day. Is that all right with council?
Yep.
Yeah.
Great, thank you. All right. So in regards to the discussion of the motion that you brought forward, Mr. Stevens, yesterday with reading minutes,
Yes.
what I request, if possible, is that we have people who would like to provide public comment via email. There's a specific email address they can send it to, and they make a note that it's for public comment. So this week I have none that do that. Would that be acceptable to both of you moving forward?
But isn't it the same thing? I mean, if they send us an email, it's part of the record and we've got it. I'm not sure.
Some people have expressed an interest in wanting to have their emails read. That's why I'm saying that we would ask them to please note that they want specifically it to be read in session.
Huh. It's not really part of the open public meetings, whether we're in person or not.
Well, this is a position I would like to move forward with. I will respectfully ask council for their opinion.
Yeah, so I like the prosecuting attorney's recommendation, which is indicate that we received email and who it's from, what the subject matter was, and roughly a summary of their position, which is, anti-phase 3 opening or for phase 3 opening or whatever. And indicate that these will be part of the record and that the council has gotten it all.
All right, Mr. Stevens, are you okay with that?
Yes. Sorry, I muted myself.
All right, well then, going forward, that will be what we would do. I have a few here that I will follow that process then. These are emails that were all sent to us. One was sent July 13th from Catherine Blaine, attorney at law, from Orcas Island. She practices in San Juan County. Was in support of the Superior Court Clerk's office. The next one is from Evan. Bill, is that what did I do what you asked?
Yes, sir.
Okay. The next one is from Evan Perlotz, and I apologize, administrator from the village at the harbor from Friday Harbor. Thanks. Don't envy the position you're in. As a business owner, I need tourism to survive. Basically, be nice to people, and let's keep moving forward, being safe. Megan Harold, titled, let's see, not sure which island. Oh, from Lopez, regarding parks are crowded. Megan Harold is a park ranger at Spencer Spit State Park on Lopez. Visitors are having a hard time at 50% finding spaces. That they feel like there's rogue camping going on. It's putting a strain on the infrastructure. Opening at phase 3 is risky and not something they want to support. Christopher Evans from Orcas Island, not supporting a move to phase 3, not representing small businesses, saying we're moving forward cautiously. Maybe we're not. Stop talking about using the little guy as a reference, and don't move to phase 3. Listen to Dr. James. Jennifer Horn, letter from the studio. Thank you for the work you're doing. I was disheartened that the county's being asked to pull the application to go to phase 3. A small business owner would like us to go to phase 3. Sorry, let me rephrase that. Yes, interested, wanting to go to phase 3, but concerned about can we handle it, support phase 3. So that's all I have right now. Is there anyone on the line? It looks like there are potentially 4 people, so I'm gonna go through this. The first number is 360-378-2906. You have 3 minutes. Please state your name, which island you're from. if you have public comment. All right, I'm going to mute you. I'll come back if you need to. Linwood Honda, I think this is Mr. Nielsen. Would you like to provide any public comment?
Yes, I would. I'd like to encourage the council, as I've talked to some of you, to consider with Dr. James just removing the 50% limitation on lodging. San Juan County is the only county in the state with that limitation, and a lot of other actions have been taken with face masks and social distancing and other limitations, and many of the accommodations options, like some of the private residences or the, in our case at Snug Harbor, we have 20 cabins that are all far apart from each other, standalone units, and there is ways to allow people to stay safely and be at 100% occupancy on the island. We'll just ask that, regardless of the phase 3, to consider removing the 50% restriction on lodging. Thank you.
Great, thank you. I have Peter Lane. Would you like to provide public comment? Okay, I'll mute you. Outlook in Sarah Farish, I assume?
Yes. Can you hear me?
Yes, you have 3 minutes.
I don't really have a public comment this week, but I am here to listen, and thank you for all of your work, and I think that's it. I'm here to hear what you have to say.
Great, thank you. The last caller, I have a number of 360-378-7689. Would you like to provide public comment? If so, please state your name and which island you're from. All right, I didn't hear anything. So one last time, if there's anyone who'd like to provide public comment, I muted everyone. Please unmute, and you have a chance to speak if you'd like. Again, one more time, is there anyone who would like to provide, have public access time or public comment at this point? All right, without sitting on, we will move forward. Is 9:13. We have a minutes, 9:14. So I will pause it. Mr. Stevens or Mr. Watson, do you have anything in the interim you'd like to bring up?
I could sing a jig or something.
I just wanted to ask you, since I'm working from home and I'm here alone, I know that in about an hour I'm going to have some sort of, I'm going to have a delivery, and I might ask for a quick recess, if that's possible.
You know what time?
Well, they're in the ferry line right now, so it's going to be over an hour.
So, Mr. Stevens, just let us know, and we'll take a break at your discretion.
Okay. Is that okay? If it's not, I'll just step out.
No, it's perfectly fine. We just let us know what you need, and we will try to adapt and meet your needs there. So not a problem at all. Thank you for the reminder. Or thank you for the information. It is now 9:15. We will be opening up a public hearing to adopt an ordinance regarding amending county road speed limits. Map District 1, continue from July 7th. Colin Huntimer, are you on the line?
I am, Council. Good morning.
Good morning. Colin, I assume there's nothing has changed from last week?
Correct. This ordinance that you were briefed on last Tuesday has remained unchanged. The public hearing was extended at your request to provide Council further time to consider the proposed changes and to provide additional public comment. Just as a reminder, it is amending the map for District 1, the lawful maximum speed on county roads, and sole purpose for the inclusion of County Road number 157, Missing Mountain Road, establishing a speed limit of 25 miles per hour. I have the map available if you would like to bring it up on your screen. Otherwise, I have nothing further to add.
I'm fine. Do either one of you need to look at the map again?
No questions.
No questions.
Okay, great. And just for the public, last week we went through the public hearing, didn't have any comment. It was a good presentation, extended solely because wanted to follow the process to give the public one more opportunity to look at this. For housekeeping here, Mr. Watson, Mr. Stevens, I'm comfortable, and we'll ask for public comment, but I'm comfortable moving forward on this today if you are.
Okay, well, let's see if there's public comment.
Great, okay. Is there anything else for staff?
No, not at this time. Thank you.
All right, well, without seeing that, we will open this public hearing to adopt an ordinance, open the public comment section of the public hearing to adopt an ordinance regarding amending official county road speed limit map, District Number 1. At this point, is there anyone who is on the phone who would like to make public comments about this speed limit change in District 1? Again, I'd like to ask, is there anyone on the phone who would like to provide public comment for this public hearing regarding speed limit change in District 1? And one final time, is there anyone who'd like to provide public comment in this public hearing regarding a speed limit change on District 1? Without seeing any, I will close the public comment section of this public hearing with the right to reopen. Council, thoughts? Questions?
Nope. If you're willing, I'm willing to make a motion.
And Mr. Stevens?
That's fine with me.
All right, I entertain a motion at this time.
Mr. Chair, I move we adopt an ordinance regarding amending official county road speed limit map District 1 as presented.
Second.
We have a motion and a second to adopt an ordinance regarding amending official county road speed limit map District 1 as presented. Any comments or questions from council?
Nope.
Nope.
Without seeing any or hearing any, all those in favor, please say aye.
Aye.
Opposed? Motion carries 3-0. Thank you very much. Our next public hearing is to adopt a limited tax general obligation bond ordinance, which is again a continuation from July 7th, which I think was a continuation from the week prior, with Rhonda Peterson, Treasurer, and Mike Thomas, County Manager. Mr. Thomas, are you available to provide any changes in this public hearing request and to give us status on the bond?
Yes, Mr. Chair, I am available. To be clear, I'll ask Council to move the public hearing forward another week. I will say, and good news for sure, is that our conversations with the person and with our partner Rock Island were very productive. Last Friday, I received a revised statement of work from Codan, which I am currently reviewing along with John Kane and others. And then on Monday, yesterday, we got a new agreement from Rock Island. So we will pour over these documents to get them hopefully in good shape for next week's council meeting. But appreciate the council's patience and the work on Codan and Rock Island's part to get these agreements turned around in a short period of time.
Mr. Watson, any questions or comments?
No, not for me.
Mr. Stevens, any questions or comments?
Well, no, if we're not ready to do it, we should probably just continue it.
At this point in time, I will open the public comment section of this public hearing. This is a continuation of the public hearing from the week before and the week before that. Is there anyone on the line that would like to provide public comment regarding adopting a limited tax general obligation bond ordinance? Seeing any, again, I will ask a second time, is there anyone in this public hearing with public comment regarding adopting a limited tax general obligation bond ordinance? And for the final time, is there anyone in the audience who is listening in via Skype interested in providing public comment to this public hearing to adopt the limited general tax obligation bond ordinance? Without seeing any, I will close this public comment section of this public hearing with the right to reopen, and would entertain a motion for extension to July 20th for a continuation of the public hearing Friday Harbor at 9:15.
Mr. Chair, you want July 20th or July 21st?
21st, please.
July 21st, excuse me.
Okay. Mr. Chair, I move we continue the public hearing to adopt a limited tax general obligation bond ordinance to July 21st, 2020 at 9:15 a.m.
Second.
We have a motion and a second to continue this public hearing to adopt the limited tax general obligation bond ordinance to July 21st at 9:15 a.m. in Friday Harbor and on Skype. Any comments or questions? Without seeing any, all those in favor say aye.
Aye.
Opposed? Motion carries 3-0. Thank you very much. Our next discussion is...
Mr. Chair, could I ask a quick question?
Sure.
So does that mean the statement of work we won't be doing? Under number 2?
Mr. Thomas, actually, let's move this around. My apologies. Mr. Thomas, let's...
Yeah.
An action to approve a resolution authoring a statement of work with coding communications and service level agreements with Rock Island. Mr. Thomas, would you like to give us an update per Mr. Stevens' comment, and what kind of action do you want us to take today?
Yeah, thank you, Mr. Chair. No action. Basically, my same comments as I did on the bond. So these we're not ready to present new documents. So there's no action requested of council. Obviously, the documents need to be ready and approved by council before we entertain the bond, and we're not ready to do that at this time.
So, Mr. Thomas, that means we would just move this
to the 21st, please.
So, Ingrid, if we could please move this action item to the 21st, is that all right with council?
Yes.
Great. Thank you very much. Our next item is our COVID-19 weekly emergency response update. Kyle Dodd, are you on the line? Mark Tompkins, are you on the line?
I am, yes.
I don't see Kyle dialed in. Will you be handling our update for today?
I will. I didn't realize you guys got done with your public hearing so quick, so sorry about that. I was on another call.
We are trying fast to move fast.
You guys went extremely fast, so sorry about that. So Kyle is actually on Orcus today. He is over with our testing team doing some of the asymptomatic testing on Orcus today. I think they have over 30 folks that are being scheduled for asymptomatic testing today. So I will be pinch hitting for Kyle, trying to match what he provides to you. So bear in mind, I will do my work on the data, and then for Kyle, what he wanted me to talk about, I think all of you are aware. We had 3 new cases identified over the weekend and yesterday morning. All cases were on San Juan Island. Our surveillance team has been hard at work identifying all close contacts. We're well over 20 close contacts for those 3 cases. So lots of work going on there and lots of potential for additional cases as a result of that activity. So more to come on that. And I believe Dr. James on the line can provide further updates. But again, incredible work from our surveillance team working into the evening on Saturday, most of the day on Sunday, and then with another positive coming in Monday morning early. So lots of work going on there. As I mentioned, our testing efforts are well underway. So we have both what we call our ring testing around cases and outbreak testing. And then as part of that, we also do asymptomatic testing for essential frontline workers with the idea to test and work with larger businesses and test individuals who have more interaction with the general public and may have more contact and be more exposed to see if there's any cases that are out in the community. We last week completed 61 at one of the local businesses, and one of those results is one of the positives that we ended up with. So it actually it is effective. It may not, be what everybody adheres to for certain things, but it is shown that we can identify and pick up positive cases. So one of those was picked up last week as part of that asymptomatic testing effort. I think by the time we complete this week, we'll be well over 200 tests from our team. And that team is made up of county staff and some volunteers that are helping us. So incredible work from that group. And we're moving around the islands trying to do that and looking to do that asymptomatic testing on Tuesday, with hopefully getting the results not on Saturday or Sunday, but either Thursday or Friday, so our team is not working all weekend is kind of the goal. Speaking of that, I want to let the council know that we have been successful in filling our term limited nurse position that is critical for these testing and case and contact investigation. Her first day was full-time with us was yesterday. She was one of our on-call staff that was filling in between shifts in her other job, but now she has started full-time with us yesterday. And she's also on Orcus today as part of those testing efforts. And so you jump right in with lots of testing going on her first day. And her name is Emily Mason. She is a local resident of San Juan Island, and we're extremely happy to have her on board. She again was part of our efforts from the very beginning as a on-call nurse that has been assisting us, really from the beginning, and now is working for us full time in that term limited position. So we're quite excited about that. The other thing Kyle wanted me to mention was around vulnerable populations. Again, this is the work that we are doing to make sure that our most vulnerable can continue to stay home, stay healthy as part of these efforts. There's over 275 households that are part of that program. And through last week, over 5,300 deliveries have been made to those individuals. And this is the work through our resource centers. So kudos to our resource centers to make that happen, delivering primarily groceries, but other critical supplies as well. The other thing that is on top of that is the ongoing Meals on Wheels delivery. So there's an additional about 500 Meals on Wheels going out per week through the work of our senior staff and the senior nonprofit to make sure that folks get more nutritious meals at home and can safely stay home, stay healthy. I want to get into the data now, and I'll share my screen before we talk about last week. The council asked me to check in on the phased application and the pause and what that meant for us. But before I talk about that, I want to go through the data and what we're seeing as a system. And so hopefully people aren't getting tired of this data, but this is the risk assessment dashboard for the state of Washington. And these are the rates per 100,000 of newly diagnosed cases during the prior 2 weeks. This has all counties selected. And you'll notice that we're actually up into, and it keeps creeping up, and about 112 cases per 100,000. And you'll say, well, it's kind of dipping down here. Well, this is shaded gray because as new positive cases are identified, we try to identify as a public health system when symptom onset was. And so what we're learning is some of our labs are taking 5-6 days to report results out. And so somebody may be tested today. We're not getting the results until Friday or Saturday. Upon our case investigation, we find out the person was actually ill on Monday. And so when it gets reported into the system, it goes back to the case on Monday. So it would be reported as a 713 case. So this is shaded gray because these numbers have have not been confirmed. And as additional tests are done, this will probably not be going down. It'll probably be flat or slightly going up based on what we're hearing from the state. If we were to look at our healthcare readiness system, and again, this is statewide. I would say probably the good news in all of this, even though case numbers are going up, the hospital percent of licensed beds in our system remains relatively flat, which is extremely good news. It doesn't mean it's going to stay there. What we're seeing in other states around the nation is cases go up first, and then hospitalizations follow suit. And I'll talk a little bit about, show you some more data on who is kind of driving our case counts, what age group, and right now those are primarily younger individuals, which aren't really impacting our healthcare system. So there is some good news in the data, in the fact that our hospital system, both in the percent of licensed beds occupied and percent occupied by COVID, remains relatively flat. There is an uptick going on. We're about 3.4% right now at the middle of July, where if you go back to the middle of June, we were at 2.5, so about a percentage point higher. And so you can see that from the beginning of June through the midpoint, we are creeping up slightly. And so it's something that will have to be looked at as we go forward. We'll want to touch base on our 5-county region, and just so folks can see what we look like as a 5-county region. So just select these real quick. So here's where we are at as a region. So this is looking at percent of licensed beds occupied by COVID cases. We're actually going the opposite direction as the state. So we were at 3.3 at the beginning of June, and that's down to 2.1. These are so that's actually good news for our region. If you look at hospital beds, we're actually, more of our hospital beds are occupied than elsewhere in the state, but still below that 80% threshold for our 5-county region. If we were to look at the disease activity for our 5-county region, you'll notice that we are plateauing in about the 55 to 60 per 100,000, so lower than the state, but still above the goal of 25 cases per 100,000, and it's not necessarily going down. It's kind of staying right about there. And again, I think based on talking to some of my counterparts in our surrounding counties, they're seeing in cases as well. And so it kind of gives you an idea of what's going on there. Want to flip over to another chart. Dr. James talked about this last time, and this looks at, and this is the modeling data from the University of Washington. And this looks at what happens based on models if there's easing of restrictions, mask use, so on and so forth. And so if you go down to the daily deaths here, it's kind of hard to see, but if you look here, our daily deaths are coming along about 6 or 7, and it anticipates that with mask use, they'll start to drop. And if you have universal masking, and it goes along, and the red line is if restrictions are eased, it goes up significantly again in November, but with mask use and good mask use, it stays relatively low. And so, that is something that really should encourage everybody to continue with very good mask use, because it will, based on modeling and based on what we're seeing so far, go a long way in preventing the illnesses and deaths associated with that. The next item is around daily infections and testing. Again, it just shows that with mask use, which is that lower green line, the daily infections, estimated infections go down significantly with the mask use and restrictions in place. And then it also then protects our healthcare system. It just really shows that a simple device as a mask goes a long way in preventing illness, infections, and then associated hospitalizations and death. The last thing on here is on this social distancing, and this is measuring, I believe they're using phone data and mapping how people are moving around. And this is the purple line is observed. And so back in the end of March, beginning of April, it was down 50%. So very good. This is when the Stay Home, Stay Healthy order first came in into our state. And since then, it slowly has been creeping up. And the last confirmed date was back in the end of June, and about a 19% reduction in people's mobility based on what they call the typical mobility. So as folks move between the phases, as you start getting closer to summer, people are moving around more, and that is depicted by this, and certainly I think people would see that in our islands as well. The other item that I wanted to share with council is actually the situation report. So this is the situation report from the state of Washington. It is through July 9th, so it's about 5 days old. But there's some key things in here that I think everybody needs to understand. And so this first one is this effective reproductive rate, so what they call the R naught, and anything below 1 means that you're being ahead of the curve, and that means that for every case that you want it below 1, that means you're actually winning the battle, so to speak. It means that less than 1 person for every new case is being transmitted to somebody else. We're not below 1 anymore. We were below 1 back in May, and the purple line is Western Washington. That has slowly creeped up, and the R naught value now is above 1. You can see that it's out here, it's about 1.5, 1.6, and in Eastern Washington, it has been above 1 essentially the entire time. And continues to remain above 1. So that is concerning news, obviously concerning news for Washington State. When this is above 1, that means you're having more spread and you're going to see increased cases, and cases will continue to increase until this gets back down below 1. And so we need to be working on that as a system. If you're looking at the resurgence in cases, they broke it down by county. These are different charts. So the purple are phase 2 counties, the charcoal are phase 3, and then the orange are the modified phase 1 county. And you can see there's a lot of upticks here in case counts in various counties around the state. And so that is also what I would say be concerning to the public health system. And then if you were to look at the looking at it, new cases, and this is look at the Puget Sound region. You can see there's an uptick going on right now in the Puget Sound. The tests are up as well, and the positivity rate is slightly upticking. You can see that. If you're looking at Spokane County, the number of new cases is up sharply, and so they're testing more, obviously as a result of that, but their positivity rate is increasing as well. And then the last one is in Yakima, and so you can see that they seem to be going down right now in the number of new cases. Testing remains about the same, and their positivity rate is going down as well. So it looks like maybe they're getting out in front in Yakima County, which has been having a sustained outbreak going on there. The last thing that I want to kind of touch on is the age. And this is the age frequency of new cases from the last 2 weeks. So these bar graphs, you can see by the age distribution, are looking at the counties on top. And so it kind of gives you an idea. So this graph here is from Benton Franklin. This is King, Pierce, Snohomish, Spokane, and Yakima. You can see the biggest bars in almost all of them are around the age bracket of 20 to 29. And so significant increases there in the number of cases. If you look at the population distribution for that same age group in those counties, it is not proportional. So obviously they're running about 13% of the population, or about the same population in all those counties, yet the percent of new cases is significantly higher in those groups. So I think that there's work to be done with our younger population about gathering size, mask use, and some other items that we need to look at as a system. So I'll stop there and ask if there's any questions on our activities or the data before I get into the application and the request from council to check on the status and what our options are. So I'll stop there and ask if there's any questions on the data.
Mr. Watson?
No questions at this point.
Ms. Stevens?
Yeah, Mark, since we've been getting so many of these results on the Friday afternoon or the weekends, what would it take to have a second team trained up on surveillance and case tracking? So we get, because I'm trying to look forward on this, and this is regardless of what phase we're in, we're going to be doing this for a long time, and to get those people a break, or something, a reliable break, put it that way. And also, I think, as in Dr. James's correspondence points out the fact that we need to have the capacity, and we need to give these people a break. So I'm just wondering, how many people is it? What would it take to get a second team trained up?
So yeah, excellent question, Jamie, and thank you for that. So we're looking at several different options. So we're looking at with some of the testing, and we actually had a phone call with our medical partners last night, and the delay in some of the lab reportings based on some of the larger national labs, looking at maybe having staff take breaks on Tuesday, Wednesday, and so they actually get a couple of consecutive days off as an option. And we'll go along sometimes for a week or two with no new cases, and all of a sudden we get 3. And if there's lots of case investigations, it's an all-day effort. The case and contact tracing, you need there's training that goes with it, and then there's the actual doing the investigation and having somebody observe that. And so we have several folks trained, but getting them the time behind the wheel, so to speak, with somebody kind of there assisting as necessary, has been a challenge to get them that next step. And so we're looking at ways to make that happen and to make sure we have good coverage. Getting this term limited, getting Emily Mason on staff is a big step. Obviously, today she's focused on testing, and she'll have some other testing to do, but getting her up to speed to assist with case and contact investigations will be a big help. And we do have an advertisement out and trying to fill another nursing position, which will also be helpful. And so I think we have several things in line, recognizing that we do need to be able to give our staff some breaks, and whether it's having them off on a Tuesday and Wednesday and being working the weekends or some other avenue, we're looking at all options to make that happen. We've also shifted some duties to some other staff, and I'll be talking to the Board of Health tomorrow about what we call our continuity of operations plan, which is part of our emergency preparedness, which would allow us to basically stop doing other activities and focus efforts on this. So we have been maintaining our other activities throughout this pandemic. And so as an example, if we activate our COOP, we could, as an example, say we are no longer going to provide this service because we don't have the staffing capacity to focus on the response. And so that's a discussion we'll be having with the Board of Health tomorrow as well. So lots of information there, and hopefully that answered your question, Jamie.
So the people that are trained, so it's like they've got a temporary license. Somebody needs to make sure they do it right before that you can turn them loose on their own.
Yes.
Okay, thanks.
And we do have a small team. So we have our primary person, and she's our lead, and that's our CD nurse, Steph Stuckey. But we also have some on-call nurses that right now are the ones that are providing that assistance to her. We have a couple other staff members who have had the training but need that time behind the wheel, so to speak, and to get further up to speed. And we're having them do more activities associated with this, and we'll continue to work on that to make that happen.
Thank you.
Mark, is there any way to give us a little bit more information about the 3 positive cases that just were identified? Breaking any HIPAA or other privacy issues?
So what I could tell you is that all 3 were on San Juan Island. We have, my understanding, have completed 2 out of the 3 investigations, with all close contacts being identified and asked to quarantine. The 3rd case, the investigation, I think, was nearing completion yesterday, with the close contacts being asked to be quarantined. There was a large number of folks that needed to be contacted, and through our investigation determined whether they were considered a close contact and asked to be quarantined for 14 days. That did result in some businesses having to figure out if they, what their staffings were and if they could remain open. We're working on a document that will go out to businesses on what it means if you have a positive case and or a close contact within your business, and hopefully getting that pushed out to later today. And so I don't know what more information you would like. We have obviously privacy concerns that we have to, and confidentiality concerns we have to respect.
Fair enough. Could you, as you touched on the retail or the small business scenario, hypothetically, if you have an office of, or like a business of, I don't know, let's say 10 people working in it, and a positive case happens, could you explain what that information is you're sending out today, what that business owner should consider doing, and then maybe what kind of support, if any, that the county would offer?
Sure, yeah. So obviously the first step is to initiate our case investigation with the individual who tests positive to determine their work schedule, their close contacts within the business, what activities they do, and as we go through that, we would be identifying who needs to be quarantined. It at some point will become a decision of the business owner. If they're a small business and they have a staff of 5 and 3 of them are out with isolation or quarantine, they may not be able to function, and they may not have the staffing to keep their doors open. We would again, as part of that, work with the individuals and the business owner or manager. We would contact them and let them know if there was a positive person there, and so they were aware. In most cases, the employees are reaching out and talking to their managers or the owners of the businesses. In these situations, the individual is contacted by their primary care provider, and they let them know that what their test results are. A lot of times we are getting that information a little bit later or doing the contacts a little bit later. And sometimes these business owners know before we've reached out and started our investigation. I would say for most businesses, they need to really have a good, should have a safety plan in place. They should be adhering to all of the guidelines around mask use, social distancing, hand washing, making sure that they have sick leave policies that allows the workers to be home if they actually are symptomatic, and to really have the and check with their staff on a daily basis and make sure that they are not symptomatic. And so I think discipline and vigilance around those items of wearing face coverings for both their staff and consumers, making sure that they have frequent hand washing, minimizing the number of staff interactions that are within 6 feet. They need to really try to maintain 6 feet in between themselves and minimize the length of time they have within there. Clean and sanitize and wipe down their commonly touched surfaces. Again, having those sick leave policies and encouraging staff to remain home if they're ill. And then telework. If those are options. Not everybody can do that, obviously, with retail and retail operations. And so I think those are what I would advise anybody to do, is to have that plan in place and have those other items in place, which then limits the number of close contacts potentially between your employees. That would be my advice. And Dr. James, do you have anything else you'd want to share in that regard?
No, Mark, I think that covers most of the issues. And we, of course, will consult with anyone that has specific questions on demand.
All right,
Yeah.
thank you. So,
The other thing I would mention, Rick and council, is that the business owner can contact us. We have a COVID hotline, which is 360-370-7500, and we would route their calls as appropriate to help that business owner if there's questions. So again, that's 360-370-7500, and we are and have developed a press release that'll be going out very shortly to business owners with this information.
Great, thank you. Mr. Stevens, Mr. Watson, do you have any questions for Mark on what we've covered so far?
I don't.
So this actually may be for Dr. James. So based on the 3 cases this weekend, can you roughly estimate when the transmission occurred?
Sure. One of the dates of onset was actually the 2nd of this month, so it's been a while ago. The other was probably onset on the 4th. The delay in getting testing results is a very significant issue. National labs, because of the failure of leadership at the national level and in various states, those national labs are now out between 5 and 8 days in reporting results. So in one of these cases, one of the people was actually tested on the 6th. We found out on the 12th. That's a huge disadvantage in terms of these kind of case investigations. People are optimally infectious in the 48 hours prior to the development of symptoms. So you got to go back 2 more days. So we're starting at a disadvantage in that respect. And these cases are occurring in the 20-something age range, and that's not where they've been in the past. These people are more gregarious and more spending more time with other people their age. They are less likely to follow some of the recommendations we make about things like mask wearing. And so I think that we are at risk. And it's not just here. Statewide, the preponderance of the cases are actually in that 20 to 40-year-old age bracket. And that's a change. Now, the good news is fewer people are hospitalized, fewer people die. But it certainly puts everybody else at risk. So I think that, The other big change right now is that in the past we've been able, honestly, when we do our investigation, we just look for the person from off island. I mean, that's where all the cases have come from. There's a mother-daughter spread, a husband-wife spread, but nothing outside of the household in our community ever. I think that with these cases, what we'll come to find out, most likely, is that this is community-based spread now, that we're going to have to be looking on the island for cases that we don't know about. With the delay in testing and with the challenges in this particular population, I think that we're in a very difficult place now. We're in a very different place than we were a week ago. Very different. This is, I don't know if you recall, but I mentioned community-based spread. I believe that this is the beginning of community-based spread in our community. We have been incredibly fortunate not to have that in the past. The adoption of the masking order back in May has served us extraordinarily well. It's become a little bit confused with the governor's order and ours both being in effect, and we tried to build kind of a crosswalk where people can easily understand what the rules are. But I believe that that's still the most important thing we could be doing. That's what all the academic projections suggest. That's certainly what we need to do. We haven't had much non-compliance with it. We've had broad-based community acceptance of that, but we're going to have to double down on that, and we're going to have to find a way to reach out to these younger people that believe that going to the beach in a group isn't going to hurt anybody.
So would you say that we've seen the impact of the July 4th weekend then?
To my knowledge, to date, all the cases we have, virtually all, with maybe one exception, have not been from tourists. That's one of the reasons I was willing to go along with applying for phase 3. Even the cases we're looking at now, these are people that have lived away and returned home. All the other cases we're still investigating some, but almost all of our cases have been family members coming to visit, have been people going off island, have been those kinds of things. It hasn't been tourists. So I don't know if we're going to see a bounce from the 4th of July. It's not represented in these 3 cases. That's not what this is about. We may still. There's a period of time we're going to have to wait to find out. And with the delay in testing, that people have to develop symptoms. That takes time. Now we have to add to that period of time, which can be a week or more long. We have to add, this delay in testing results, which might mean that we're 2 weeks out before we even find out about a case. Right. So we've been given some real challenges here. These are very substantial challenges. And I was glad for Jamie's question, actually, that what can we do to stand up more testing folks? Basically, we have right now we have a weekend team so that Steph cannot be working 14 hours a day every day. And that's working pretty well. These are retired nurses, often very skilled. The skill in doing those case investigations you just can't train somebody to do it. You have to convince somebody to tell you things that they don't want to tell you. You got to know all the people they hung out with. You got to know the things that they don't want to tell you. In some cases, people aren't entirely truthful. And the problem with the virus is it doesn't care whether you tell them the truth or not. I mean, everybody's going to find out what you did. You may as well cop to it in the beginning. But you can't have a discussion like that. Most of our nurses that are good at this do STD tracing. So they have to call somebody on the phone and say, you've got gonorrhea. I need to know the 6 partners you've had. I need their names, phone numbers, and addresses. That's not an easy conversation to have. And it's the sort of thing we have to do, though. We have to ask people to name names of businesses that they have frequented, sometimes that they've worked in. These are extremely sensitive and difficult things to do, and to get good information. That's the key, is having that rapport on the front end. And we have very few people who can do that. We got people trained in the mechanics of it, but actually the art of it, it's an art. It is not something easy to do. So and we're working towards, the addition of Emily to our team is a big, big deal. I mean, that's another highly experienced, super well-trained person that is on our team. It's the cavalry coming over the hill from my point of view. Extraordinarily, and person that rooted in the community. She knows who's who. So that's a huge deal. And I think the additional nurse we're trying to hire is another place where we'll get really high quality well-trained technical people that we can train up and get going on this stuff. So I'm optimistic about that.
Great, thank you.
Mr. Stevens, do you have anything else for Dr. James at this point?
Not at this point.
Okay, so Dr. James, I have a quick question for you.
Was Mark done? I mean, I'm going to give a little talk when he's finished, but I think he might have had more to say, unless you want to.
Well, I just have a mask rule question, and I was going to go back to Mark. Is that all right?
Oh yeah, absolutely.
So I'm getting a lot of questions about some nuances of the mask ordinance, and I just want to make a quick statement, and if you can tell me if this is correct or not. All employees are required in a business inside to be wearing a mask if they're going to be within, if they're not going to be working alone in that space. Is that correct?
That's correct. If they're working alone in an office, they aren't required to wear a mask. If they're going to be with other people, then they are required to wear a mask, yes.
Great, thank you. And
now, just a second. So that's actually the governor's rule. Our rule applies to, my order applies to businesses not allowing patrons to come in and frequent the place without a mask on, categorically. The governor's rule actually has always been that employers are there required to have masks. And then there's the L&I rules, which are yet another overlay, which say that you have to protect your employees by having masks worn. So John and I worked out a crosswalk to try to make this clear, and I'll be bringing that forward. But there are many different sets of rules we're working with here, not just one. And so the employee rules are not our county rules. Those are going to be L&I and the governor's rules.
Right. I'm not really trying to assign who said what. I'm just trying to make sure that the public understands that there's, through the layering part that you mentioned, that these are the requirements. The next thing, how does, regardless of who the order's from, if someone has a prescription or a note from their doctor that they don't have to wear a mask in the workplace, that is not adequate enough, correct?
No, it's more complicated than that. Our rule requiring masks in businesses only does not apply to employees. And so that would be the state or L&I's rule, and they do provide for exceptions, unlike our rule, which is categorical. So and unfortunately the ADA law is a very interesting law in that what it says is that if someone isn't wearing a mask and they say, I don't have to wear a mask, you're not allowed actually to ask why. The ADA protects them from having to disclose the reason for their disability that requires that. Now, having said that, if someone is sick enough to not be able to wear a mask, they probably need to be in the hospital, honestly. And there are doctors in our community that will and have written notes saying people shouldn't have them when it wasn't clear to me that it was necessary. But if a doctor signed off and given this person a note and you're trying to interpret the state laws, I think the governor's going to be permissive about it, although I would urge anybody that has a question about that to consult their own legal counsel, because there are sometimes contradictory rules, and the L&I rule is much more protective of employees, and the ADA rule is much more protective of the disabled person, and those can be in conflict. And you're unfortunately then required to kind of adjudicate that from a legal point of view. And I'm not a lawyer. I'm not going to tell anybody how to do that. That's going to be something that requires a higher level of legal expertise than certainly I have.
I get that. I'm just trying to get an understanding from your perspective on what you see. And then my final question on the mask rule is, I think it was 2 Fridays ago, or maybe last Friday, it all seems to blend together. The governor said that you cannot serve someone at a business counter without a mask. So I've had a couple questions over the weekend about this. My suggestion to the person was, please ask them politely not to be in your store, and that you'll bring something out to them outside if they need it, but you can't serve them at the counter. Is that a correct interpretation?
I think it's more complicated than that, and it's an interpretation is still evolving. So one of the places where that applies, for example, is in drive-through. where even in a drive-through situation, does that apply to the person driving up? Do they need a mask to drive in their car to a window and get the product? I believe that the ultimate interpretation is going to be that they are required to have a mask. Now, that's not the way it's done currently, and and I don't know that it'll ever get clarified in case law. So there are going to be those gray areas where you have to be somewhat pragmatic about things. I think the risk in the situation of the person driving up is probably very, very small. Maybe not zero. The details would always matter. And so much of this is being done on the basis of goodwill and understanding. I think we need to educate people about the importance of it, because at the end of the day, they're going to do it or not based on their belief that it helps them or their community. That's what's going to make this work, not the letter of the law, not the policeman giving you a ticket. And so I think in the refusing service at the counter, I think that's really complicated, and I don't know the answer to it, because I believe that there are exceptions provided by the governor, and the question is how those exceptions will be applied. And honestly, I don't know the answer to the question. So people can, with disabilities, claim that disability, and they the thing about the ADA law is you have to make reasonable accommodation. You don't have to make unreasonable accommodation. We've been down this road already with a person that wanted that there was a great deal of accommodation offered to. They found that unacceptable. We, together with the store owners, suggested that we had made all the reasonable accommodation that needed to be made, and in the end, they made an ADA complaint that was not ever carried out. That when their lawyer talked to our lawyer, they said, "Oh well, we understand. You've made reasonable accommodation. You don't need to make unreasonable accommodation."
Great. Okay. Well, thank you, Dr. James, for that. Mark.
Wish you were clear. I'm sorry.
Oh no, that's right. No, thank you very much. Mark, back to you for the. I know you had a final subject you wanted to discuss. Sorry about the segue.
No, that's okay. So last week we were requested to look at I think as council knows, we made application for phase 3, and that application was placed on pause, with the governor announcing that they placed all applications on pause. And the request was to ask us to look into what that meant going forward. The 2-week period ends on Thursday. I reached out to my counterparts at the State Department of Health to see what that meant. We really have 3 options. And as the council that directed us to submit the application based on the recommendation from the health officer, then the board, the 3 options are to leave the application sit there, and if and when the state decides to reopen and process more applications, what I was told is they would take our application that's there. They would look at the data that has came in since, and they would make a determination on our application based on the review of the data that they have as part of the data reporting system. That's one option. Another option is for us to request a hold, and again, the application can sit there. We can ask them to hold our application until we do a more thorough review. And then the final option is we could ask them to send our application back. We can say we want to remove our application for phase 3. If we do that, we would then have to reapply and go through the process that would be in place at that time. So those are really our 3 options to consider as part of the phased application that we have in place. I would anticipate that the governor will make an announcement on Thursday on what his intentions are, whether to continue with the pausing of the applications or to start to process those again. Based on the information that I presented today, with cases increasing, the R naught values above 1, My best guess is that they will continue to pause the process, but that is my guess based on the data and what the state is currently facing and what other states are doing as a result of cases increasing. You probably heard some states are rolling back. California rolled back some of their reopening plans. Others are putting everything on pause. So I would anticipate with the case counts here in Washington State that same approach would be applied here as well, with pausing applications for the time being until more is understood about these increasing cases and to see the ideally case counts going down and that are not valued back under 1. But that is again my interpretation based on the data and what has been done across the nation and the state so far.
So, Mark, is this going to be on the agenda for tomorrow's Board of Health meeting?
We have a COVID update, and we could certainly have this as part of that COVID update, yes.
I mean, would not the Board of Health need to participate in deciding what to do with our Phase 3 application?
Good question, Councilmember Watson. How it works, if you recall, it starts with the health officer making a recommendation, the Board of Health either accepting it or modifying his application, and then the county council essentially would either agree with the Board of Health and then as part of that instructing us to make application. So I don't know, I haven't had a legal review to say who would be the one that would have to ask to take a step. I would say it would be based on that, with the council instructing us to make application. The council would be the final one saying, do you want us to pause, put it on hold, or whatnot? That'd be just based on the process. Now, you may want to ask the Board of Health for their opinion, but I've not asked our prosecuting attorney for a review of that based on the application process.
So, Mark, Bill, were you done? I'm sorry.
Yes and no, but go ahead and ask your question.
Well, that's what I was thinking too, is if we just left the application there, it just stays there. But I just wanted to say I agree with your surmising, because as we've seen this roll along, it seems like the governor has already foreshadowed what he's going to do. He extended a bunch of proclamations through August 7th, which includes the Open Public Meetings Act adjustments. So that means we can't meet together regardless. So it just seems to me like on Thursday it's going to be an extension for a couple weeks or whatever. It seems like these, even though they're not connected, they seem to follow each other. I'll put it that way. And I would think we would just leave it, because if we don't, like you said, if the data does not support our application at whatever time they go to look at it, then it won't happen.
Dr. James, do you have an opinion?
I do, and I sent an email to everybody, including the Board of Health, recommending that we withdraw our application, actually. I think there are things in Phase 3 that we can do safely at this point, even now. But there are a number of things that we can't do. My thought is this. So I think that my interpretation is sort of along Mark's line. There is no defined process. My interpretation is this: your application is the county council's application, and you can withdraw it or keep it, whichever you like. At the end of the day, I believe it's your choice to do that. I have already made a recommendation to withdraw it myself. That recommendation is going to go forward to the Board of Health tomorrow, and they can either agree with me or not agree with me. Again, there's no defined process, but I think you would benefit both from my opinion and from the Board of Health's opinion, although I believe at the end of the day, it is your judgment that will prevail. The things that lead me to believe that, I think, is that the state continues to not meet standards for moving forward. And those things are moving in the wrong direction, not the right direction at this point in time. Our county has, I believe, has community-based spread going on, and that's a big deal to me, because I think once it's Once it's in our county, we're in a very different position than when we just can go and look for where's the out-of-county connection. I also believe that we're at the limit of our current staff's ability to respond and do timely investigations and limit the spread locally. We are at the limit. And I'm at my limit, honestly. I mean, I haven't had a day off in 3.5 months. There are human limits we need to consider. And trust me, I hear every day from people going bankrupt or having financial difficulties because of decisions I've made. It's not that I'm not aware of that. People know that those decisions have been my decisions. I hear about it. And I'm sympathetic. I'm very sympathetic to them. These are not places where they're easy decisions to make. I've been reviewing the liberalization that take place in many other states. They're looking at going back on the dining piece, not forward, but backward, eliminating it entirely in some cases. It turns out that sitting around a table without masks and eating together isn't such a good idea. That's something I'm looking carefully at. At the same time, it's the very survival of many of our businesses. Again, I would look to you and especially in your capacity as members of the Board of Health to advise me about that. I mean, what's the right business thing to do? How do we do the least damage? The other countries that have done well, and we're in that group with the other countries in many ways, and I think we should all be proud of that. We're a place that doesn't have sustained local spread, and we reap the benefits of that. Unlike those countries, though, we can't require a 14-day quarantine before somebody comes to visit. And so we continually are going to be at risk. Now, as I said earlier, the tourism has not to date been a problem. It really, one case of that where it's really been the problem. That doesn't mean it won't be in the past, in the future. It doesn't mean the 4th of July isn't going to have a delayed effect and we're going to get smacked by it. I think we've done a good job. I think our citizens have done a good job. I think many of our guests have done a great job of keeping all of us safe. But I think now is not the time to move forward boldly. Now is the time actually to go the other direction. As little as we can, but as effectively as we can. So I personally think that our application is already completely out of date. None of the data in it is relevant at this point. We've had more cases. The states had more cases. Our situation is not in a better place. I think it's just the honest thing to do, honestly, just to simply withdraw it. And I think it also gives a message to our community. I don't want false security. We can't be thinking we're doing great because we're not doing great. Right. And we are at the limit of our ability to deal with these diseases. So those are the reasons that I'm making that recommendation to the Board of Health, and I'm happy to talk more with you about it here or then.
So, Mark, has Council seen that recommendation?
It was an email that I believe Dr. James sent to the Council and Board of Health yesterday.
I don't remember seeing it.
The message, Bill, was at the very bottom of the analysis and the graphs and stuff.
And very small font.
Very small font. I missed it twice.
Okay, so it came from Dr. James.
Yes.
Yeah, and it was to the Board of Health.
So, Dr. James, what can we move? You were saying that some things in phase 3, but some 3. What can't we do as applied for with your modifications?
Pardon me?
Well, our application is more of a 2.5 than a full phase 3.
Exactly, yeah.
So you said there are many things we can do in that, but things we can't do. So I'm just wondering what can't we do? What is, because of the change in situation, what are things we can't do as the application sits?
Well, not only can we not do them, but I'm actually looking at rolling back the dining rules. I think there's a real definite risk there. Now, I'm still collecting data about that. I still want to know, and we're still, with these investigations, we're going to find a lot, because these 3 current cases involve a fair amount of dining involvement. and I think we'll know more soon. But it's the dining component that I think is most concerning to me. I think there's some of our businesses that are just caught up in the structure of these orders that are being kept from being open that don't need to be kept from being open. And so in many of these things, I think all the things we approved in there, many of them are not different than what we do now, honestly, and we're, I think, unfairly punishing those businesses. Unfortunately, the only tool we have to control the influx of people coming here are rules about where they stay. It's not a particularly rational approach to it, but it is the only tool we have. So it's really around how many people are coming here, and the second thing is really about the circumstances around dining together. Now those are both very powerful tools and kind of blunt objects to be doing what we're doing, but they're the only tools we have. So those are the two areas that I think are significant. As you know, we are currently at 2, and that means local travel only. That's the governor's intention. That's the functional intention of that rule. Now, so far it's worked out fairly well for us. That doesn't mean that it will continue to work out well as disease spreads in the states and the adjacent counties. If we could actually have local travel only, I would be in a very different state of mind about what we can and can't do. If it were just us, if we pulled up the drawbridge, we'd be back to normal in no time. But we wouldn't have the tourist industry. That's the deal for us, and that's the nut that's really hard to crack.
Can I ask a quick question regarding the travel ban? The governor did modify that language, and it's as vague as it's ever been. But it did become a more open. And let me back up. First of all, I think we should have a meeting of council after the Board of Health to talk about this tomorrow. I don't have a problem with the county either withdrawing or pausing our request to move forward, but I still struggle with this whole travel thing, because I've had this question a couple times, and the language, and I'm pulling it up right now, and I apologize for the delay, but the language for phase 2 says essential travel and limited non-essential travel for phase 1 and 2 permissible activities. So that's everything in our county. That makes it travel is fine. If you want to go to a hotel, that's a permissible activity. If you want to go to eat at a restaurant in town, someone could come from wherever. So I caution, or I guess I'd like a better interpretation, because I get this question 100 times, and the first one said locals only, and I agree with you on that, but it was changed. So, I would love some direction on that too, because, I don't want to be in violation or supporting something that's in violation of the governor's order, but the order doesn't make any sense.
Well, the order is not enforceable, bottom line. I mean, so we can finally dissect out the nuanced meaning of the order and its modifications. The reality is there's absolutely no enforcement.
Okay, but I think we need to, I agree with you, but I think we can't say it's local travel only when that's not the way it reads. That may be the way it was. And again, I'm not supporting this language. I'm just saying it's vague.
I think it's intentionally vague, but I mean, I don't know the reality is there are no travel restrictions right now in our county. That's the reality. And we got to live with that. The governor is not going to suddenly start enforcing it.
Okay.
And so
Council.
what we do has to be done in the context of knowing that anybody can come here from any place, anytime. That's just the reality that we have to live with. We can make all the rules we want. If they don't have any effect, then they're not real rules. I don't care what the governor says, because not enforcing it means that we have broad-based travel from any place at any time.
Dr. James, can you hold on one second, please?
Sure.
So, Mr. Watson, Mr. Stevens, I need to figure out if we can have a meeting this fast if we want to tomorrow, but would you like to meet tomorrow or wait until Tuesday to discuss?
I'm fine with tomorrow, and I'm available.
Okay, so I am going to work with the prosecuting. Mr. Watson, are you okay with that too? I'm sorry.
I was just going to check my calendar. I think tomorrow's the better idea Unfortunately, I do have a meeting right after the Board of Health meeting. But I guess that could be pushed off.
Well, Bill, we could also just recess until your meeting's over.
Right, okay.
So, assuming that we can do this, we have enough time to notice our portion of this meeting. Do you both support having the meeting within a meeting like we've done prior to discuss a modification to our request for moving forward in the phasing system?
Well, I think the sooner we get an answer, the better, right? I mean, I think we should be the
Right.
masters of our own destiny. So we got to decide what we're doing with our application versus just, I guess, allowing the default, which is we leave it there.
No, and I agree, and I think that every decision we've made has been a point in time decision based on the information at that point, and it has changed. And
Yep.
so we promise throughout this whole process, moving forward or backwards, to be cognizant of the change in the science and to try to make science-based decisions as they're modified. So both support setting this up tomorrow.
Yep.
Yep.
Thank you. I didn't mean to cut you off.
This is Randy Gaylord. I had a question.
And who is this?
Randy Gaylord.
Oh, sorry. Hello, Mr. Gaylord. Yes, sir.
I understand you want me to be present for the meeting.
I didn't say that one way or the other.
I understood you were asking for advice from the prosecuting attorney's office, so I thought that you had questions about the language and legal effect of orders of the governor and other matters. Is that correct?
No, that isn't, Mr. Gaylord. I was just trying to make sure I haven't had a chance to speak with Ingrid yet, so I was going to either ask your office or Ingrid if we could have the council meeting within 24 hours of time.
Oh, yes. You can have a special meeting of the county council within 24 hours. It's 10:30 now. She would have to get the announcement out 24 hours in advance. I would suggest tomorrow afternoon, early afternoon, given that what I've heard about schedules. I was just wondering about the exact time.
Great. That's all I was trying to confer is what we had to do to make sure that we're legal. So yes, I mean, you're always welcome to attend and listen and provide comment, but I wasn't relying on you specifically or requesting your time. So we will get a meeting within a meeting, and we'll try to get that posted as soon as possible.
We'll need the exact wording of the agenda items.
Mark, can you get us agenda language?
Sure, I'll work with Ingrid, and remember the Board of Health is at its normal time, 11:30 to 1:30, so we can have the council in early afternoon. I'll get something over to Ingrid right away.
Yeah, and if possible, let's do our 5-minute before call the meeting to order and then recess.
We can try to get something out to make that happen.
If not, we'll just meet in the afternoon. Fine. Okay. Thank you very much. So, Dr. James, I kind of cut you off, and I apologize. I just wanted to address this process question. What else would you like to provide for us? Or is there anything else you'd like I kind of cut you off in the middle of your presentation, so do you have any more additional information for council? Mark, is there anything else that you think we need to be providing information today regarding COVID?
Yeah, not that I could think of. So I will work with Ingrid on language for the council meeting tomorrow afternoon, and we'll go from there. So open any other questions that the council may have regarding COVID.
I had one question, and it's too bad Dr. James dropped off. But
I'm here.
Oh, in regards to the dining, and I don't know how it is on Orcas and San Juan, but our restaurants, and when I had to go to the doctor, I noticed it elsewhere. The restaurants that can't really handle 50% inside are continuing to do takeout, and the only ones that are actually seating people are the ones with adequate outdoor dining space. And I'm wondering if that could be a consideration, and could you take that under consideration in your considerations?
Absolutely, Jamie. And I think what other jurisdictions have done is they've been pretty creative. They've actually closed out parts of streets and allowed for more outdoor dining at the county level. And I think to the extent that we could accommodate with the town of Friday Harbor and with other jurisdictions, that if we allowed for more outdoor dining, that would be a way that would be beneficial, I think. The other science that didn't get talked about today is there's growing evidence, there has been for several months actually, that there is some aerosolized spread in enclosed spaces. And even there's good evidence now that the protests, these big massive protests that were pretty unruly and people singing and chanting, did not lead to increased number of cases. The outdoor nature of things is a very positive predictive factor. And so I think to the extent that we could expand outdoor dining, that might be a way where we could allow even not rather than contraction, maybe even expansion, if that were possible. And I know that's not possible for everywhere, but that is a consideration. And the aerosolized spread in enclosed spaces has been a major new decisions gone up through WHO. The CDC remains silent because I think they don't know how to measure, how to really put a metric in place to protect people, given that it's a relatively uncommon thing. But public bathrooms are not a place you want to be. There's good data about them, and there appears to be a significant increased risk there. But I think in terms of the dining, outdoor dining would be definitely a direction that would be possible to go.
And Jamie, to answer to your question here, I think we're seeing it countywide is the majority of establishments that are smaller are just doing takeout still. And it's just the larger ones that have outdoor seating that are able and are open. So I think that's a pretty common thing, not just here, but probably across the state as well. They're in phase 2.
Thank you.
Mr. Stevens or Mr. Watson, do you have any comments or questions?
Not at this time. I appreciate the update.
Yeah, thank you to Mark and Dr. James. Brendan, do you have anything you want to provide? All right, I'll take that as a no. We will stop this subject matter at this point. Mr. Stevens, out of a courtesy for your request, if we break now until 11, will that give you ample time for your the break you needed?
We can just take a break, and if I have to get up and answer the door, I'll do it. Thank you, though. Thanks for the consideration, but there's nobody here, so.
Oh, okay. So a 15-minute break now, is that all right?
It'd be great.
Okay.
So we will come back at 10:50. Thank you very much. And I really appreciate Dr. James and Mark, your update today. And please pass on to the nurse team and specifically Susan, our thank you and appreciation for all the hard work and extra hours they're putting in to help keep the community safe. So thank you very much, as always, for the dedication of county staff and volunteers to work to keep us healthy and safe. Thank you very much. We will be in recess until 10:50.